Okay, good morning, everybody again. Welcome back. We are going into the session 2, and we're very fortunate to have Ms. Michelle Barnett from the Office of Research Development, Ethics Administration, and she's going to present on MIOS training. She's the expert on the MIOS program, and all students and staff have to become familiar with this, but I'm going to allow Michelle to unpack that for you. And without further ado, let me hand over to Michelle.
And it's a lot easier just to address any issues at the time. All right, so just a brief history on MIOS. MIOS is the Mandela Ethics Online System. It is a cloud-based package, and we have licensed it from a company in the UK, along with 5 other institutions in South Africa. It comes as a blank slate system in which we can put on our own questions, our own process flow, and change it as we like, but there are certain things that we cannot change. And currently, all faculties in Mandela are now online, and we have something like 150 approved applications online, as well as about 150 that are in various stages of the application. So I'm going to jump straight to how you would go about doing an ethics application. So a starting point before you bookmark the various pages would be the research development website, which is rd.mandela.ac.za. And from this page, you will see that we have 2 ethics committees listed in this right-hand panel here. We have Research Ethics Committee Human and Research Ethics, the Research Ethics Committee Animal. Prof. Tutu will be addressing the Rec A side of things, but the process for completing a form on MIOS for an animal ethics application or a human ethics application is the same. But I'm going to deal with the human application currently. So one would click on Research Ethics Human, which will bring us to the Research Ethics Committee Human website. There are a number of points on this page. The first is the meeting dates. These meeting dates, if you click on it, these are the institutional Rec H meeting dates. For your own faculty's meeting dates, please contact your faculty administrator. We have reference documentation. There's a lot of information here that's quite relevant to the health sciences faculty. The health sciences faculty, for example, good clinical trial practice, retrospective use of patient medical records, etc. And at the bottom of this section, we have a number of templates that you can take and adapt. For example, your informed consent form and assent form for child participants, etc. But in terms of starting an ethics application, you just scroll down the page and you would come to the section in the middle with a link to MIOS Apply. All good? Okay. All right. So this is the link to start your online application. And we have now moved all the user guides to the main page of the Rec H website for easy access. And there are quite a number of them: the applicant user guide, a short video on starting an ethics application, how to share your form, updating project explanation, etc. We've also just added a where to get help with MIOS. Okay, and I'll just address that later. And just at the bottom of the page, if you are wanting to submit amendments, extensions, study progress reports, etc., if you click on any of these, it will give you a brief update and then a link. We also have a section at the bottom for ethics training, which will take you to various ethics training sites that you can complete ethics training online. Right, there are a number of various options. Right, and these you can all go through at your own leisure. But to start an ethics application, you would click on mios-apply.mandela.ac.za. And I would recommend that you actually bookmark this. This takes you to the MIOS Apply splash page. and sign in for Mandela's, the Ethics Online system, is using your Mandela username and password. So those who are not registered cannot actually complete an ethics application online. All right, so it's your username and your password, and it will take you into your work area. I'm just going to show you the work area that you will see when you first log in. It will be completely blank. There will be no projects, no notifications, signatures, etc. The most important thing to do when you first log in, this is as a student, as a supervisor, is to update your personal details. And we get this question a lot. 5 fields are passed across from the Mandela servers to MEOS, okay? Your title is not one of them. And unfortunately, the system requires your title in order to send out the documentation. So you would click on the arrow next to your name in the top right corner and select personal details. And I'm just going to update this one. Put in your title. You can see that it doesn't pull through faculty or campus. These are also required. So I should just. And then you would just change your details at the top. And then when we create a form, those new details will automatically pull into the relevant sections, which I'll show you in one of the other views. Right, so I'm going to move back to the work area that I'm going to be working on, and we're going to start with creating an application. Right, so the first thing that you do to create a project is click on the Create Project icon. And then enter a title. If you cannot, at the time that you're creating an application, remember your title of your study, it doesn't matter, you can update it later. And then you select the form. Okay, we've got 2 Rec A forms for research and practicals and 1 for human. I'm going to select the human and create. Once you've created the project, you will notice that there's a couple of things that are important on this page. The status is important, okay? And then you would just start completing it, okay? It is a dependency-based system. So is this application, I'll do the first one, is this application a reapplication? If you say no, it doesn't ask you anything more. If you say yes, it will then ask you for further information, okay? This one will be a no. Is it an undergraduate course-related activity assignment? No. And then you just carry on going through the thing. So this study type, this is very important. Your study type, if you are collecting data from participants, you would click this one. And this will then bring up questions relating to consent forms, assent forms. Okay, so it's important that you actually read these questions because they inform what you are shown later in the form. And this is where your study title is. So I'm going to cut. There are 2 study titles. There's a full study title. And this full study title is the actual study title on your research proposal or your study. In the majority of cases, it will be the same as the short title. Okay. Please don't put your name. We've had a number of applicants, they go and put Michelle, application for human ethics. Okay. Please put your title there because this title is used in the emails that are sent out, in the attachments that are sent out. The only reason that we have 2 is that in very, very rare cases, we have a title that is longer than 200 characters. And in that case, it doesn't, it won't work in the email. So for example, this can only be 200 titles at the top here, and that is your short title. The data collection date also does cause some concern. All right, this data collection date is an anticipated date. All right, so please don't put next week if you're only submitting this week. All right, and the other thing is it is not an exact date. So I would say take into account whether your application is low, medium, or high risk. I'll be going into that in a while, and put a date that is relevant. All right. Remember, if you put next week, you cannot start data collection. You can only start data collection when you have received a letter of approval. All right. So if you put June and you receive your ethics approval in May, you can start data collection. This is just an anticipated date. Right, so I'm just going to put a date. There are a lot of check boxes so that you say you confirm that you've not started with recruitment or data collection. You confirm that you will not start with it until you've received ethics approval. So all the way through, we are emphasizing the fact that you must wait for your approval to be granted. And then lastly, you would obviously select health sciences here, and this will ensure that your application is channeled through to the health admin team. All right. So in terms of the actions that you can do on the form, the actions appear in the left-hand panel. So obviously previous and next goes to the next or previous page. Navigate takes you to the main list of questions again so that you can jump around if you like. So I'm going to jump to the risk assessment and just discuss this. So for those of you who may have completed an ethics application using the old form, you will recall that there was a multicolored sheet that had 4 columns on, and you would tick relevant boxes. So for example, does your study involve children under the age of 18? That automatically makes it a high-risk application. This is that template in an online form. There are some changes, and there are some changes coming down to try and simplify the risk assessment template. So for example, if your study does not involve anything in the high risk section, you would click none of the above. But if your study involves Mandela staff or students, which a lot of the studies do, you would click there. And then it doesn't really matter what you've clicked elsewhere. It automatically is flagged as a medium risk study. All right. But please, this is reviewed by the reviewers, and it is also reviewed by RecH. The risk assessment of a study is one of the critical things that the National Health Research Ethics Council looks at. Okay, so it's very important that this is actually completed accurately. So just go through it, complete all the things. It also does give an indication to the reviewers what your study is about as well. All right, so that's the one thing. If it comes up as a medium risk study, the process is that it will then go for a faculty review. All right. So this is I'm not going to discuss the departmental review process because we are busy looking at that at the moment, but this would go to a faculty review process. And then as soon as faculty have reviewed it and approved it, that's not issuing a letter, they've approved it at a faculty level, it automatically goes to RecH, in which case, and then it gets reviewed again by institutional committee. Right. If your study comes up as a low risk study, the current process is that it will then get given faculty approval once you've attended to revisions. It will be issued with the approval letter, and then every single application then goes to RecH for noting. And RecH checks titles, target groups, they can call them up. So it is imperative that you do this as accurately as possible, because you don't want a situation where it's been approved as a low-risk study and you get approval, you start data collection, it is then recalled by RecH, in which case any data that you've collected, you'll be asked to discard, and you will have to start again once you've received the RecH review. Right, so this risk assessment, I cannot stress how important it is. Right, I'm going to navigate to another section that sometimes causes some issues, and that is adding your PI or PRP. So you as the applicant are automatically the principal investigator on a RecH application. All right. So the first question is important. Are the principal investigator and the primary responsible person the same person in the study? For anything for degree purposes, the answer will be no. All right. And you will see that if I scroll down, your details as the PI are automatically pulled in. So we get a lot of questions where people email us and they go, I can't edit this. I can't put my title in. Okay. And this is why I say, please read the notes that are on the form. There is a section here. Please update your personal details, and it tells you how to do them. All right. It is grayed out because it is pulling in from the system. All right. The only one that we can't put in that is you would have to put in your student number. Okay. All right. And then scrolling down, you then need to add your PRP. Once again, please read these notes. Okay. So you would need to search for your PRP. So I'm going to choose one of my test users. And if I click on it, it will pull in the details. If your PRP does not appear, or your supervisor does not appear on the list, that means they have not logged into MEOS at all. So what you need to do is just ask your supervisor to please log into MEOS. That automatically transfers their details across. You will then be able to find them. Okay. So that's how to get your supervisor on the system. And then once you've done it, you can then click and it will then pull in their name, surname, and the email address. The other ones we have left as editable fields because we have some supervisors who will log into MEOS, but then they forget to update their details. So we've allowed it so that you can fill it in for yourself. All right. But I'm going to navigate again. And I'm going to show you how to upload a document to your application. So in the old system, you would email your form with all your appendices. You would then forget to add one, and then you'd be asked, and there would be multiple emails going backwards and forwards, and things would get lost, and there would be version control. Yeah. You add it all to the application, and it goes in one bundle. All right, so I'm just going to click to funding and other study details as an example. Okay, so what is the purpose of the study? If you say not for degree purposes because you're an academic, nothing happens. You don't need to give proof of registration. But if you are masters, for example, it will then automatically ask you to upload your proof of academic registration. All right. Another way to get help, you'll notice that all the way through the system, we have these little I buttons on the side. Please use them. So this just says where you can get official proof of registration if you haven't got it. Okay, so we have information buttons. And to upload your document, you just click upload, you browse. I'm going to use a test document. You upload it, you can see it's there, and then remember to upload it there. And it then appears in the body of your application. If you've uploaded the incorrect document, you can delete it and upload again. Okay, so all the way through, you will be asked at various points to upload. So you will be asked to upload your research proposal, proof that your research proposal has been approved. You will be asked to upload your data collection instruments, your recruitment information, and there's various, your gatekeeper letters if you're using them. So all the way through, you'll be asked to upload that. Some people then upload them all again in the additional information section. Please don't do that. It just creates a burden for the reviewers, okay? If it's already been uploaded, it's attached. All right, and this is a live system, so as you do it, it saves. All right, I'm going to go through the actions in the left. So I've gone through these. This viewing as PDF. If you click on view as PDF, it prints a backup of your application form as it stands. Not all the documents, the application form. All right. The save button, I would recommend that you save as you work through the system. As you move between pages, it automatically saves. All right. But if you are busy, for example, if I go to, we have had this once before. If you, for example, are working on the background and rationale to the study, and it's taking some time, and then you get disturbed, but you haven't saved or moved to another page, and then you walk away, it will time out after 90 minutes. Okay, so please just use the save button to avert that happening. All right, so this is just the brief outline of a project. It is just an online form. You can edit it at any stage. It always stays in your work areas. So if you are starting your research project and you're still busy in the project proposal, you can start your ethics application as well. It can happen. It can be a dual process. The only thing that you will do is you will submit it at the appropriate time when you have the approvals, etc. All right, so I'm going to switch. No, what I'm going to do is I'm going to share this form. So one of the things that we are currently trying to encourage all students to do is once you have completed your ethics application form and you've got it into a state where you think that it is now suitable or acceptable, please share it with your supervisor, okay? The easiest way is if your supervisor is not an external supervisor, but it has Mandela credentials, is to share it. And the way to do that is to use this roles button. And you would search for your supervisor. And then I'm going to assign them as the primary responsible person. And then I'm going to share it. Right. So I'm going to quickly switch to my supervisor role. And you can see that the supervisor, test 1, has already got test 3 and test 1 shared with them. All right. There's 2 shared with them. I'm going to switch back here. I'm now going to share. And if I switch back there and I refresh the screen, health test 2 has now been shared with them. All right. So your supervisor has full edit rights on your application. So the roles are predefined. So your supervisor or the PRP, they can edit it, they can sign it, they can make changes, etc. All right. You may want to, switching back to the applicant now, you may want to share it with a colleague. So for example, you may be a master's student and you would like one of your colleagues to actually have a look at your form because you don't want to submit it to your supervisor, but you would like somebody else to have a look. You can share it with anybody. So I can share it with another test user and I can just give them read rights. So that means if they log in to their work area on MEOS, it will appear. If you've just given them read rights, they'll be able to read it. They can comment on it, but they cannot do any edits. So this can be shared with multiple people as required. If you have a co-supervisor, you can share it with them as well. All right, so that is the sharing. And what happens when you share it is that your supervisor will automatically get an email saying that you've shared the form with them. And then they can then go into their work area. So my recommendation is that you don't share it when it's an empty form, because you don't want to waste their time. Rather, complete the form, then share it, and then send them an email going, I've done the form, please could you have a look at it? All right. And the other thing I want to tell you is that this does not take away from meeting your supervisor face-to-face and the normal email correspondence that you would have had. This is just another tool. The sharing functionality is just another tool to help you collaborate on your ethics application.
So now,
Yes.
in a case whereby my colleagues is shared as with me, how will I find it? How will I see it?
So you will get an email. So if your colleague has shared it with you, you will get an email to your Mandela email address stating that it's been shared with you with a link on it, and you will just click on that link and it takes you to the main page of the application. Or if you've lost that email, but you know they've shared it with you, you would just log into your MEOS work area using meos-apply.mandela.ac.za and it will appear there. So very much like this is my applicant side that I'm showing you. But if I click now to my supervisor side, it's the same view. And all of these have been shared with that supervisor.
So the one that is shared with before is.
All of them. All of them. So because I've got various test applications set up, but I can remove, you can remove them as well. So if you've shared with somebody and now you want to remove it, you can revoke their privileges on your form. Okay, so you would just log in. So I can do that here. This is my supervisor. So I'm just going to apply here. I'm just going to access it. So let's say this was your work area. Somebody's shared it with you. You would sign in and it would appear in your work area. So any projects that you have created would appear here, but anything that's been shared with you would also be here. And as you can see who the owner is. So for those supervisors that have multiple students, the owner would be different. So for example, I'm the owner here, but maybe it's Ms. Brown or Dr. Smith or whatever. Okay, so you would automatically see who actually has who owns those projects. Was that help? Cool. All right. So, okay, can you go ahead with the question?
Good morning, everybody. Thanks for allowing me this opportunity. I just want to know, does MEOS, if you have an external moderator, like not affiliated to Mandela University, how does that work? How will they have access to MEOS to get this process going?
Okay, so they cannot get access to MEOS because MEOS is a single sign-on system. So it requires you to have Mandela credentials. All right, I'm going to actually go into that on the next form that I'm going to show. So I'll actually deal with that now. I'm going to switch from, and this should answer your question, from Health Test 2 to one that I set up this morning and it is almost complete and ready for submission. So I'm going to click to this one. And this one I went through and I've added all the documents and answered most of the questions. If you have, I'm just going to click through to it. If you have an external supervisor that needs to look at your application, they are not going to be able to access it and comment online. All right. You will have to do it using the same system that you did previously by email. But what you would do is you would complete the application as far as possible. And then you can click on this documents icon in the left-hand panel. And this brings up every single document that you've attached to your application, including the form. So this has your registration, your research proposal, your approval, consent form, etc. And then you can download it. And this downloads the whole lot as a zip file, which you can then email to your external supervisor. They will then have to make comments as they used to do by email. And then you would then have to log in again and then attend to the revisions that they have requested or suggestions. Okay. Does that, I hope that answers it.
Yes, thank you very much. I appreciate it. Thank you.
Right. So this test 1 now that's almost complete. I'm just going to quickly go through some of these icons on the side. So I've gone through save, view as PDF just gives you a PDF of the actual form. Documents then shows you everything that has been uploaded. I would like to emphasize, please make it easy for the reviewers. Okay. This is just the type of thing, but please name these correctly. Okay. It also helps with version control. So if you're asked to make a change to your research proposal, for example, date it, give it a version number. It really does help the reviewers if it doesn't just say scanned. Okay. So it just, everything you can do to help your reviewers speeds up the process. The same as when you answer your questions. You know, there are a couple of places where you can put not applicable, and we're finding that some people put not applicable. And then the reviewers go back and say, but this is applicable. Okay, please answer as fully as possible. It will speed up the process. All right. This share button, as I've indicated, shares the form. This rolls You click on it, shows you exactly who you have shared the form with, and you can remove the permissions. So if you've shared it with the incorrect person, you can remove the permissions, or you've shared it with somebody to look at and now you don't need them to look at anymore, you can remove their permissions. All right. The collaborators, this is another one. This just tells you exactly who's got access to your form. This completeness check. This is very important. You cannot submit your form if the form is not complete. So if I go back to Health Test 2, the one that we created this morning, and click on it, and I click on completeness check, you will notice a long list of things that have not been completed. All right, I've just created it. But if I go to the one that I did this morning and click on the completeness check, there are only 4 things outstanding. All right, so I need the staff student number, incidental findings, and then obviously the last thing on any form is the signature. So it is very easy to now go and complete this. I can just go click on here from the completeness check. It takes me exactly to the point that I need to fill in. I can click again. And now there's only incidental findings. So I click there. I'm going to complete this now. And the only things now outstanding are the signatures. So the form is now, to all intents and purposes, complete. So at this point, when you've completed it as a student, is you would share the form with your supervisor, okay? And they can then go on and make comments. You can also make comments. So for example, if you are completing your form and you are not really sure what to put here in the benefits of the study, you can click there and add a comment. And save it. Okay. And this adds to the comments here. As you add a comment, it will automatically appear in your supervisor's view. Likewise, when they go through your application, they can also make comments and it will be seen on your side. So I'm going to just switch back to the supervisor view. I've added a few comments. And there, I am not sure if correct. All right. So your supervisor, we can see exactly who made the comments. So here the supervisor's made 3 comments and I've made 1 as the applicant. I'm in the supervisor view. The supervisor can click and it takes him to the exact part in the form where you are having difficulties. And so likewise, they can make comments that you can see. So for example, if they go back to the applicant view. Okay. I'm going to click on, this is the supervisor comment. You can click on here and I can then see that the supervisor wants me to put it in as bullet points. Okay, so this is just one way where you can use the comments functionality to communicate at the point in the form that there's something to be added. Because obviously when you do it by email, if it's not clearly outlined where you are actually commenting on, you can actually miss things. So here, if it's on the objectives, they would make their comment on the objectives. If it's on the background, they would make it on the background. And you would be able to link directly through. Right, so that is the comments functionality. Once your supervisor's checked it and you're now ready to submit, you as the applicant need to initiate the process. All right, so this is the applicant view. I'm going to navigate to the declarations and signatures. And this is where you sign it. It is an electronic signature. So you just click the sign. It will not allow you to sign if you've left any questions out. All right, so you brings up a declaration. Please read this because you're signing to this. And then you would accept it. Once it is signed, you will notice that there is a gray banner at the top that says this form has been locked and you can no longer edit it. All right. And if I move down, it says this form has been signed. Please remember that you are signing that you are happy with what you have submitted. So there can be no edits after you have signed. But if you suddenly remember that you need to upload another document to the additional documentation section, or you've omitted a gatekeeper letter or something that you have, it hasn't been picked up, what you would do is you can unlock it. The minute it's locked, an unlock button appears in the left. If I unlock that, it will tell you that any signatures have been invalidated. If I confirm it, you'll notice the signature disappears, the banner disappears at the top, and I can edit again. All right. But what you do need to remember, and we've had a lot of people do this, is they think that because they've signed it once, that it is now signed. Every single time there is an edit on the form, it needs to be signed again. Okay. The final step on any form is your signature. All right. So I'm going to sign it again. And then you need to request the signature of your PRP. So you would just click here, find your PRP. You can add an optional note if you want, request it. And what this does is it automatically sends an email to the PRP asking them to sign. Please remember, if you unlock it, the signature request is cancelled. Your signature is cancelled. You need to sign again and request the signature again. Okay. So as I said, the final step are the signatures. We have unfortunately had in the past an application that sat for 2 months because somebody didn't realize that they needed to get the signature again. So please remember, it must be signed. All right. So I'm just going to switch to the supervisor view just to show you. What will happen is they get an email, but they will also get a notification in their signature tile. And if they click on the form, it will ask them, they can then sign it. These sign buttons will appear. They can go through it again and comment. They have 2 options. The supervisor has 2 options at this stage. They can reject your signature if they've picked up something else that needs to be done, or they can sign it. So I'm going to sign this one. They also get a declaration. They sign it. At this point, it would automatically be submitted. Okay, so it's an automatically submission process. As soon as both signatures are on the form, it will be submitted to the admin side for review. All right. This is a beta. This is the test environment. It needs to be manually submitted. So I'm going to submit it. So this would automatically happen for you. Return to your work area. And if I check health test 1, which I did, you will now notice that its status has changed to submitted, that its application type is now medium risk, and that it's been given a review reference number. So this is where I say that you can actually track. So if you go onto your work area and you see unsubmitted, you know that something's outstanding. If you see submitted, you know that it's in. I have a third one here that I'm actually just going to briefly explain. So for those of you who are not aware of the review process, what will happen once it's been submitted, it will then go through, talking about faculty review at the moment online, will go through faculty review. All right. It will be assigned to the next meeting. It will then be assigned to reviewers. Those reviewers will add their comments on the online form. Okay, you can't see it automatically. This is in another section of the system. They add their comments. It then goes to a meeting, and your application will be discussed at the meeting. And then you will be sent feedback. All right, that will be actioned after the meeting. And the feedback will come in the form of an email. So I'm just going to quickly go to one of these. Sorry, I'm just going to try and find it. All right. It will come in the form of an email like this that is copied to you, the applicant, to your supervisor. No, this is an incomplete one. Sorry, this is. Okay, and it will have a letter attached to it. Okay, and that will outline all the changes that you need to attend to. You can also go to your work area and click on notifications. If you've lost that email, you will see here, your application has been reviewed, changes are required. Please refer to the attached action memo. You can click on this attachment and it brings up the action memo. And this tells me that you need to do the background to the study, research design elements, etc. So this outlines it, and it is always in your notifications area. So if you've lost the email, it will be in your work area. If your supervisor's lost the email, you can download this and send it to them. They are copied in on the email, but it will not appear in their work, in their notification area. All right. So the process when you've been given feedback. So this is one, health test 3 is one that I assigned to a meeting, I reviewed, and we sent feedback, which is what I showed you just now. And you can see that its status is changes required. So as soon as it has been sent back to you as the applicant, it is unlocked and you can edit it. So the process is exactly the same. You would click on it. Okay. The first one, I know that one of the things that had to be attended to was the rationale for the study. So if I make a change here, I'm going to make another change, added extra. Okay. You have a compare with previous submission button at the top here. So as the applicant, also the supervisor can see this. Once you've attended to the revision, you can actually compare with your old version and you can check exactly what you've done. So with this one, I've just added a new sentence to the background to the study. Right, so then I return to the edit mode. You can, if you've been asked to upload another document, let's assume that this one is incorrect. I'm going to upload another document. Doesn't matter which one it is, a test form. Upload anything. So I've deleted that one. I've uploaded another one. If I compare with previous submission, it shows me that I deleted this one and I've uploaded this. So before you submit your revisions again, compare your form versions because you can check all the changes that you've made, either on a page or if you click on all changes, it will bring up all the changes that you've made and it's hyperlinkable. All right. So I can click to background to the study again if I want to make another change. All right. So the process to resubmit your changes after you've been given feedback is exactly the same. You would email your supervisor and say, I've attended to the revisions. Please, can you check them? All right. You would then, once it's checked, you would then sign it, request the signature of the PRP again, and that will automatically submit it. So please remember, every form version must be signed, otherwise it will not be submitted. Once it's submitted, the liaison that has been assigned to review your revisions, they will check the revisions that you've made, and they will do one of two things. They will either go, I'm happy with this, at which case the faculty administrator will be informed, and then they will either issue the approval letter or refer to Rec H. Or secondly, if you have not attended to the revisions adequately, the liaison will request more changes, and it's a loop. You will receive an email It will appear in your notifications area. You will attend to the revisions. You will sign it. You will submit it. Okay, and that will go on until such time that you have approval. And the same process occurs at Rec H. So if your application is referred to Rec H for review, you will get assigned to reviewers. It will be assigned to a meeting. You will get feedback. You will attend to the revisions. You will assign it, etc. All right, so that is really the process for submitting an application online. Yes.
Yeah, so looking at the flow of the document, because after I signed for a goal to the supervisor, and then all goes well to the right page. So now with the right page, after they made a comment, does it come back to when obviously I'm gonna get an email and then come up?
Yes.
So will I be able to get it immediately or just to go through the same flow backward in this?
No, as soon as you get that email saying that you need to make changes, it is already unlocked. So the administrator, when they action the feedback, so when they click the button going send feedback to the applicant, that unlocks the form on your side and you can edit. And at the same time, the email is sent. Then just a few things to show you, if I can get there. Yeah. There are numerous emails throughout the system. All right. So one of the things that used to happen before is that it would get lost. A lot of times your emails would get lost. So all the emails, we've got the project ID always at the top of them. And there are a number of different emails. So I'll just quickly go through these just to give you an example. So when you share the form with your supervisor will get an email saying that it's been assigned to them, and they will get a link so that they can go directly into it, or there is a link to the MEOS work area. When you send a request for your form to be signed to the supervisor, they get an email. When your supervisor signs your form, you will get an email back saying that they have signed the form. Okay, so you can monitor it every step of the way. This is the email. If you are asked to make changes, you will be sent an email. It is copied to the supervisor. It is also copied to the liaison. And on that attachment that you get the name of the liaison that you can contact and go, I'm not really sure what you're asking us, etc., etc. If your application has been referred to Rec H for review for any reason, you will get an email going, your ethics application has gone to Rec H. Okay. Once it has gone to Rec H, the faculty loses sight of it, and you will have to ask the institutional ethics team where it is in the process. We also have a lot of reminders afterwards. So one of the things that people forget to do is they forget to upload their gatekeeper letters. Okay. You don't want to get to the annual progress report and suddenly realize, oops, I never got a gatekeeper letter. So I think it's 90 days after you get approval, because it takes time, obviously, to get your gatekeeper letters, because it requires your ethics reference number on it. You will be sent a reminder to upload your gatekeeper letters. All right. And with an instruction on how to do it. And after, well, it's not actually at the year, at approximately 50 days before your expiry of ethics approval, you will receive an email similar to this that will indicates when your expiry is, and it will ask you to complete a progress report, either for the point of extension or for closure or discontinuation. So this is in an attempt to remove those situations where we've had ethics approval lapsing, data collection is not complete, and now an entire new application needs to be submitted. So you will get a reminder at 50 days, and I think again at 30 days, so that you can get your extension in if it's needed in time. Okay. The subforms is the same process. All forms are now submitted. If you start your project on MEOS, you complete your projects on MEOS. So your amendment will be on the system. Your extension is on the system. If you have an adverse event, it's on the system. Everything is now done, and it is all stored in the one area. So just to show you, so if I go to the applicant view again. Okay, you will not be able to create subforms unless you have an approved project, which I don't here, but this is a beta version. So if I'm going to take this one. All right. So I'm clicking on test 1 to create. Once you've got approval, let's say 3 months later, you need to do an amendment. The process is identical. All right. The only thing is you would go to the project. You would create the subform. You would select it. So let's assume it's amendment. You would create the form exactly as you did previously. And it looks the same. It's just different questions. You would then go through, you would complete it. You would ask your supervisor to check it. You would sign it. You would request the PRSP signature and it would go for review. Okay, so the subform process is a lot easier as well. All right, so those are the MEOS emails. There are also alerts on the review side. So we remind the reviewers that they've got something to review. We remind liaisons that they've got revisions to attend to. And we also remind the applicants. So one of the biggest holdups we're finding in the process is actually once feedback has been given to the student. And some of the students will take a long time to attend to their feedback. We have applications sitting there for 8 weeks. And then only finally will the students submit their feedback, get it signed, and then they've missed the Rec H date by 1 day. And now they will wait another 4 weeks to get approval if it's a medium or high risk. So please, when you get your feedback, attend to it immediately, because that by not attending to it, you're holding up the ethics process. Okay, so that is one of the holdups. There are also holdups on the review side, which we're also addressing. Yeah. I've mentioned the tracking in the work area, so you can see roughly where it is. So please, before you get hold of your faculty administrator, and they have to then check for you, please just check your work area. If you check here and you see changes required and you click on it, you can see it says actions required on the form. There's nothing the review team can do about it. The action is required from you. Okay. Right. There's 1 or 2 last things. We are updating the forms probably on a monthly basis. So for example, we're looking at overhauling the risk assessment. So once we do that, we update the forms. And then you may, if you have created your project prior to that update, you will see the following banner on the top, and it will say there is a newer version of the project update. And most people don't want to update this. Unfortunately, we cannot change the wording or put anything else there. It's from the system. So update, there's always a check in the system. Please update the form. Okay. So you click update and it will come up with a block. And it will tell you to back up your form. Okay. So if we have changed a question, so let's say, for example, you've created your form, you've already done your risk assessment. And now we've changed the risk assessment. You will lose your responses to only that part of the form. So my suggestion is, and it tells you exactly how to do it, is you create a backup of your form using that view as PDF button. It does explain it in the update thing here. It also explains where updates have been made. So for example, if this says updates have been made to the animal ethics form, it won't affect your form at all. Okay. So I would suggest you update. And then when you update, this is how you view as the PDF. The only time I would recommend that you do not update is if your form has been signed. This is also outlined in that block. If you update a project and your form has already been signed, it will invalidate those signatures. Right. I've done so. And then the very last thing is where to find help. Please don't make your faculty administrator your help desk. Okay. There are places to find help. All right. The faculty administrator is your last resort. Okay, so the first thing, I'm just going to show you where it is. On the main RD page, there is a where to get help with MEOS document. Okay, so the first place would be the user guides. Please use them. Okay, the notes on the form, please read them. And the information buttons through it, those are mainly mainly ethics related, but some of them are, for example, how to contact student records, etc. And then also the MEOS help desk. You can also email the MEOS help desk, and we attempt to attend to any questions immediately. But please use the MEOS help desk as a last resort, because most of the questions that we get are actually answered on the form. Okay, a lot of them pertain to I can't find my PRP, or I can't update my title, etc. You know, things like uploading documents, that's all outlined in these guides here. Okay, and then of course, if you want to know where it is in the review process, please check your work area first, because it will tell you if it's submitted, if it's approved, etc. And then contact your faculty administrator or the MEOS help desk. Otherwise, that's everything. I don't know if there's any questions.
Mr. Mokaseng or Ms. Mokaseng, you'd like to come in?
Thank you. With this, I'm just trying to find the timing or the correlation of the ethics approval and the proposal submission. When the ethics feedback comes to say, maybe look at the background or other factors that might also affect the research proposal, does it mean also that we have to amend or correct the proposal? Just the exact timings between the ethics application, the online application, and also the proposal submission. Thank you.
That is quite difficult for me to answer, is that's more a faculty or departmental process. Just you know that we are looking at the departmental ethics. This that I've explained is at a faculty review level, and it requires your approved research proposal. But if there are comments on your research proposal that you need to address, it can be uploaded when you do your feedback. But I think that type of question is probably best answered by the department. Sorry, I can't be of more help there. Are there any other questions?
No more questions from the floor? One more question, yeah.
It's not a question, but it's more a comment. Okay, I'm thinking now, as long as we know when there's a challenge, there is a place to go to, because it's a practical. You won't know if you got everything until you are practically doing it. So as long as we know who to contact, where to go when we face those challenges.
And I want to say that this is an online form. You can't really do anything wrong on the system side. So your answers are obviously important from a review side, but in terms of the system, don't worry about pressing buttons. You're not going to do anything wrong. Okay, you can't delete your whole form. Okay, there is no unless you can delete the project, but it's not going to just. So if I go back here and go to the work area, you can delete a project. Okay. But you have to select the project that you want to delete. So you can't inadvertently delete your project. Okay. And on the form, if you share it with the wrong person, just remove the permissions. They will get an email going, shared with you, and then they'll get another one going, it's been unshared with you. Okay. So please don't worry about clicking on things. If you click on a dependency question, because you're not sure what to do, click on it and then see what they're asking you, and it will obviously inform what the response should be. Okay.
Great. Thanks very much, everybody. And thank you specifically to Michelle for that very informative presentation. This is really preparing you for those of you who haven't actually, you're still in the beginning of your journey, of what to expect when you are having to get ethical approval. Is one of the biggest steps on the journey, and this MIOS system is actually designed to make our lives easier. In the past, it was very much paper-based, but now everything's online, and so it's theoretically meant to make life much easier. It's easier to track, and so I just want to thank Michelle, and make use of our research development website. Got masses of information, and it's really user-friendly. There's so much that they really worked very hard to make it as easy as possible for students to navigate the ethics process. So I just want to say, thank you again, Michelle, for your time and for a very informative presentation. And I know that you are available via the MIOS email for any questions that you might have. So you're probably going to have the questions closer to submission to faculty or to your department. Thank you very much. Give Michelle a round of applause. Thank you, colleagues. I think Prof. Tritter, the next presenter is Prof. Tritter, who you met earlier in the. Is Prof. there? Okay. Prof. Tritter earlier in the morning, and she welcomed you and just gave you a beautiful presentation on the journey. Prof, I know you don't really need an introduction. I think it's because you've been introduced already, but for those of you who haven't yet been introduced to Prof. Tritter and may have only just joined us, Prof is a pharmacist by profession, and she's a researcher who's achieved the Faculty Researcher of the Year award on over 10 consecutive years. So she's a highly accomplished researcher. And she also sits on international committees, including the World Health Organization. So you will see Prof. Tritter's flyer miles are very high, and she flies off to Geneva and places like that to meet with a World Health Organization committees. So she's very well, she's highly suitable to do any kind of presentation on research. This is just one aspect that she's going to present on. So without further ado, Prof. Tritter, we await your presentation. Thank you.
Thank you, Dr. Morton. Just to confirm, can you see my presentation? I'm sharing my presentation. Can you see my presentation?
Sorry, yes, Prof, we can see your presentation.
Okay, perfect. Colleagues, Dr. Morton, no pressure on me after that introduction, eh? Sure. Colleagues, I love research, and I had the privilege for the last number of years to serve on the Research Ethics Committee Animal. So today I'm just going to give you a very quick overview of what the Reg A committee, what they do, and the type of proposals. We are in a we are in a Faculty of Health Sciences, so most of our research is focused on human health, but there are also animal experimentation happening in our faculty, and hence the importance to also be familiar with the Animal Ethics Committee. I want to thank Ms. Barnett for an excellent and very comprehensive presentation, because I'm not going to go into the detail. From my perspective, I'm going to give you a very broad overview of what animal ethics involve and what is happening in the committee. But the process, it's a different process, but there are lots of similarities. So if you go to the Mandela Research Ethics website, you will see the human ethics and the animal ethics. So I'm going to talk about the Animal Ethics Committee, which is as important for the university. In our faculty, not all departments are involved in research on animals, but I know pharmacy, and I know in the medical school, and I know in some of our interprofessional projects, there are also animals involved in studies. So if you look at the Research Ethics Committee website, you will see the short introduction, and yes, please read what is written on these websites, because they are informative. When I started on the Animal Ethics Committee, we obviously, all people sitting on Ethics Committee must be trained. So we received training, and I learned about the 4 R's at all stages of animal care and use that must be respected. And that's replacement. If it's not necessary to use animals, that one must look at alternatives. Reduction in the number of animals used, refinement to techniques which will minimize adverse impact on animals, and then the knowledge and acceptance of one's responsibilities. If you do experimentation on animals, then you also need to care for them and look after them, and animal husbandry and all those aspects come into play. Okay, so we need to expand our view a little bit. It is from elephants to lions to ants to termites to bees to whatever is a living animal. So there are different categories of animals. I'm not going to give you a lecture on that, but whatever is a living being that is not a human, that is what will fit under animal ethics. From small animals to big animals. So Research Ethics Committee Animal is similar, but it is different. It's a university committee like the Rec H committee. It is covering all the faculties. George campus is also included. So we have our meetings, all our meetings are hybrid. The George campus usually join us via Zoom. The newly elected chairperson is Prof. Adjura Davids from physiology. Administrative management is Mr. Khan and Ms. Barnett, that you now know very well. And then secretariat is Ms. Ursula Spies. We have not up to now seen full research proposals in animal ethics, because similar to Rec H, we only moved over to MEOS recently. And I'll talk about that just now. All our members are signing a confidentiality agreement. So we, like all these committees that we sit on, they are formally constituted by the university, and there are rules and guidelines and terms of reference that we need to adhere to. So these are the terms of reference for the Animal Ethics Committee. I'm not going to read through it, but you can maybe just quickly scan. Approves all applications that comply with ethical principles for humane animal experimentation, regularly reviews establishments, managerial systems, procedures, protocols where animals are involved, and then from time to time sponsors seminars, workshops on laboratory animal science, animal welfare. And so we've got specific terms of reference that Animal Ethics Committee must follow, similar to Rec H. The membership composition is prescribed, similar to Rec H, which is different. For animal ethics, we need to have, there are 4 categories of members. There needs to be at least 1 veterinarian, then scientists, people who are skilled in talking or comfortable in animal welfare, and then also an independent layperson. So category A, B, C, and D. This is the current composition of our Animal Ethics Committee, and you can see Prof. Adjura Davids. Physiology is now replacing Prof. Pierre Pistorius, who was the acting chairperson. She was elected at our recent meeting. And then there are also vacancies at the moment, and you see the office as well. So it is a formally constituted committee. The typical Rec A meeting agenda will look like the following. There's a notice of the meeting. We will confirm the agenda, and we will approve the minutes of the previous meeting, a proposer and a seconder. Then we will look at all new proposals, applications. Similar to Reg H, we also review practicals where animals are used. If there's a fish tank in one of the departments in zoology or in our building number 12, Visual building, then obviously, and there's experimentation or it's useful for in practicals, then that must be animal ethics clearance is needed for that. We also look at annual progress reports, amendments to proposals, extensions of studies, and also study closure. There's an animal holding facility that I will talk about a little bit later, but that is a standing item on our agenda. Then our research ethics policy or any other relevant documents, and then any other matters related to animal ethics. And then also from time to time, there's training for us as members, but also for people who are doing experimentation on animals. On the Research Ethics Committee website, you will see the meeting dates. So similar to what Ms. Barnett showed to you just now for Reg A, we also have Reg A meeting dates, and they are fixed dates throughout the year. There's a cutoff date for the proposals to be submitted, and then our documentation to be submitted, and then the meeting dates. The reference documentation, and again, if any of you are involved in animal experimentation, this is a must read, because this is, when we started with our training in Reg A, it is a new world that opened up for me as a pharmacist. So we've got Reg A standard operating procedures. We've got terms of reference that I've just showed to you now. Guidelines for ethical conduct in the care and handling of animal research and education at Nelson Mandela University. Our university code of conduct for researchers, that's all researchers, not animal specific, but all researchers. And then our research ethics policy that our staff members are very familiar with and very aware of. There's also recommended reading, our South African Medical Research Council Research Ethics Policy, our Medical Research Council guidelines on the conduct of research, then our Health Research Ethics Guidelines from National Department of Health, and the WHO documents for animal health. Okay, so there's a lot of documentation in the background. So if any of you are involved in animal research, you will be exposed to these documents, or your supervisors will guide you to read and become familiar with these documents. A very important document, it's a very lengthy document, 328 pages, is the South African National Standard for the care and use of animals for scientific purposes. So when we do training, this document is also very important for us to be familiar with and to take note of. Previously on this website, we had downloadable templates for, and this was literally the slide from a previous presentation I gave, but we now have MEOS. So whatever was on the previous slide, we are now doing on MEOS, and it is a transition period for all of us. We are learning, but MEOS eventually is going to simplify and make it easier. And thank you, Ms. Barnett, for your excellent presentation now, because the principles are basically the same. The landing page, all that is similar to for animal and for human ethics. All applications for approval must from now on be submitted on MEOS, the Mandela Ethics Online System. It includes research studies like postgrad studies, but we also have non-degree studies. Then practicals, any practicals in, especially in our science faculty, a lot of practicals are happening on animals in zoology. Those practicals need to have ethics approval, use of an external animal sample collection, data from animal sample collection. So often studies have been done by other agencies, and the data becomes available for further research, or the data are collected for other reasons, but they can also be used for research purposes. So the is that already collected data can also be used, but ethics approval always needed for that. Extension of applications, amendments to an approved protocol. We often see a person started with a study and there was not enough animals. So it's a study with say whatever. There's not enough to give statistically results that can be used in a study or in a publication, and more animals need to be included in the study. So for example, say the Swartkops where they did a study on certain types of fish in the estuary and over a specific time period, and they couldn't find enough of that specific species. Now they may ask for an extension of study, another 2 months or another 2 weeks to continue with the study. It is also important to report unexpected mortality or adverse events. So experimentation is done, say for example, and we had numerous, or not numerous, but we had some examples the last year where animals were in the holding facility, and contrary to what we expected, more animals died, passed away compared to what was expected. Then a full report is submitted on that to animal ethics, and it is discussed, and then obviously steps are taken to prevent. So if it is due to, for example, I'm taking now just an example, say load shedding, and there was an electricity and cut, and the temperature in the animal holding facility was not properly controlled, and the animals then corrective action immediately. Some of the deaths, mortality is sometimes due to part of the experimentation, it is just higher than, but then an explanation is given to us. The reporting of the closure of a research study. So basically what we are saying, it's similar to human ethics, but different. Here we work with animals who cannot talk back and who cannot respond back. So it's another way of looking at ethics. We also need to report research misconduct. So if there are any cruelty to animals happening during experimentation, which is a serious misconduct, it needs to be reported. Okay, so on this website, Animal Ethics, there's also the MIAS application, supervisor user guides, and the how-to video. Please, if you're involved in animal ethics, look at these videos. They will answer most of the questions that people normally have, will be answered, and they are useful. They're not long, and it's to be highly recommended. The animal holding facility is in biology building. That's also where pharmacy department, my own department, is. It is in the basement, and yes, it is not open for visitors, but if you are involved in animal experimentation or if you plan, please contact, there are people responsible for the animal holding facility, and they can give you a tour or they can show you the facilities. Yeah, that is what I'm going to say there. Okay, so who am I? If I'm an animal, a fish or an elephant or a tortoise or an ant or a bee or a camel or a lion, I'm not food. I'm not a sport. I want to live. I do not want to suffer. I'm a sentient being. Okay, I was not familiar with that term until I started on the animal ethics. That is that animals can also perceive or feel things. Often they've got that sixth sense, often more than we do, being able to feel pain and pleasure. And that is why cruelty to animals, animal welfare is paramount importance. If we look at experimentation and the animal must be euthanized at the end of that experiment, is that a humane way to end the life of that animal? So the vets come in, and the vets and the literature will tell us what is the least invasive, the least cruel method, where there's no suffering for the animal, if the animal must. And then how do you dispose of carcasses, your animals that have have diseases and that or have passed away, how are they disposed of? There are specific rules, and that is what animal ethics also look at. Examples of projects, there are so many. Just a few. Cape vultures and their increasing threats. A race to extinction was one of the proposals we reviewed. Molecular scatology as a tool to update dietary information of southern African seabirds. That is where they look at what is excreted by the feces of the birds and analyze that. Vegetation impact, space use, and human-elephant conflict in Malawi national parks. Treatment of breast cancer in mice with targeted and nanoparticles. Okay, so it's a wide variety of topics, all involve animals. The Reg-H form, thank you, no longer this form, which was not always so user-friendly. The review process, no longer, we do it now on MEOS. Training, very important. Animal Ethics Committee has arranged training sessions. They are also in individual departments where there's a lot of animal research conducted. They are arranging for students and postgraduate students training. All the usual ethics principles apply. Harm-benefit analysis, I've talked about euthanasia. The need to sacrifice animals. Is there not another way to do this experiment? The importance of sample size. If we see a proposal and they say they want to kill 2 lions to achieve this, and we will always, I'm simplifying it now, we will always ask, but 2 lions, is that enough to give you for the scientific validity of the study? Will you be able to write it up as an article? Will it add to the scientific literature and scientific knowledge? If not, no, then the redesign the study. The importance of the study design is critical. So we do look at that as well, similar to Human Ethics Committee. It is not only about the harm to, it is also looking at, is this study, it's not a right word or right way to express it, but is the study worthwhile doing to sacrifice animals or so many animals for a specific project? Okay. The certificate, we've done training a while ago, and then with that, I want to thank you. I think this short presentation, Ms. Barnett, your presentation, I think supplements or complements what I have not covered. So colleagues, thank you very much. If there are any questions, I'm not a guru in animal ethics, but I'm very passionate and I've been a member of the committee for quite a number of years. I thank you for listening to me. Thank you. Colleagues, I can't hear anything. I am still online. I see the venue is muted.
Can you hear me now, Prof?
Dr. Morton, yes, I can hear you.
Okay. So looking at the venue, there doesn't seem to be any hands up at the moment. I'm looking online to see if there's any hands. I don't see any. I just want to know, Prof, have you experienced being on the committee? Have there been any studies which have actually been rejected because of the sort of research that they were planning to pursue?
We try never to, I think for research, we try never to reject studies, but we will advise if we think there is another way, or if there are issues with the study, like the sample size is too small. We have also looked at where sample sizes are too big. If there are no animals involved, obviously it's not within the ambit of the Animal Ethics Committee. So plants are complicated. Where do they fit in? If we talk about vegetation and the overuse of that and grazing and whatever, where animals are involved, yes. But no, I don't want to say we've never rejected, but we are. It's a support. Rec A is also trying to support good research, good scientific research at this university. So if a proposal is sent back, or a Rec A form is sent back, it is always with comments. Feedback is given to the supervisor and the students, and then they've got, again, like Rec A, the option to respond back, improve the proposal, and resubmit it. Rejection does not happen easily. If it's good research, we will always support.
Thank you, Prof. Just one other question. When it comes to animal ethics, sometimes there's an overlap.
Dr. Morton, I've lost you. There's
Sorry,
an
Prof.
overlap between.
My mic was.
Sorry, there's an
my mic-
overlap between.
Yeah, there was a if there's an overlap between human ethics and animal ethics in some instances where where you are doing research on animals where people are involved, for example, communities. Have you had any research that has involved communities and where perhaps experimentation on animals could have some effect on the communities who are sort of living with within those animal ecosystems?
Okay, so are you talking, say, for example, we do a study in the Kruger National Park and there are tourists that are traveling through the park, something like that. And it
Or
may
But you like the little villages on the edges of game parks where the community lives very closely in those environments with the animals.
I think for according to good animal ethics principles, those communities will be consulted and they will be informed that animal experimentation is taking place. Like human ethics, you will not go into a community without informing the community of a research project if the research project impacts on activities or time or the space of where the community is located. So but the focus will always, for this committee, will always be on animals and the welfare of animals. But in the context, yes, the communities will have to be consulted and their buy-in will, or their not approve buy-in, their approval, their support will be sought.
Right. Thank you very much, Prof. Just curious, interesting, because it's animal ethics is something new for me as well, and I think that with this symbiotic relation that people often have with animals, there's probably, I'm assuming that sometimes there's a bit of an overlap with the Human Ethics Committee. Not that the Animal Ethics Committee can't make the decision, I'm sure.
I think a lot of research is also happening on Marion Island, where our ocean sciences group are also obviously very active. There are also a number of projects in game reserves. On George campus is very active with research because of the courses they are offering there. It is it's different to human ethics, but there are definite the ethics principles, the basic ethics principles are the same. It is just animals can't talk back. Humans and they can't consent in the same way as and that is why the animal ethics committee is protective, looking at harm to the animal. But Dr. Morton, yeah, interesting. I must admit, I'm still learning from every animal ethics committee meeting. I'm learning new things. And it is also, there are not always standard answers for all of them. Often we debate a lot between the vets and between the people who are involved in it. And I'm sitting there as a pharmacist because of also possibly my knowledge of active ingredients that may be injected or be administered to animals. It's an interesting committee. Yeah, thank you.
Thank you very much, Prof. It's very interesting. Yeah, if you could just give Prof another round of applause. Thank you, Prof, for your time. We have now reached the end of this session. So it's almost time for. Oh, I see. That's a round of applause. Yeah. So we are going to lunch. Before lunch, if I can ask everyone, including those online, to please remain just for a couple of minutes. We're going to have a group photo at the front of the venue. So if everybody can make their way to the front, you can, if you want to get out your brushes, combs, hairspray, whatever, and you can make your way to the front in preparation for this this important photograph. Sorry, yeah, thank you. Berthlin was just saying if everybody online can put their cameras on so that we can see you. And yeah, if you.
Just as we are navigating, finding our way to take the photo, I would like to say a big thank you to Michelle and Professor Trute for doing justice to their topics. I really appreciate that. And I am sure that the delegates are quite excited. I saw a lot of them taking notes. So thank you so much. And I also understand that most of the slides, if not all, will be available for delegates. Thank you so much. Really appreciate your time.